get a lot of referrals for overactive bladder, and most patients don't really understand what that is. So it's a symptom complex where the patient feels the need to urinate more frequently or urgently than they feel is normal, that's bothersome to them, and sometimes it's associated with urgency incontinence. Now, to make the diagnosis of overactive bladder, it's mainly based on history. The patient describes the symptoms that fit. Physical exam obviously rule out any other diseases going on, and then we do have to do a urine analysis or a UA to make sure that there's no blood or infection in the urine that could be explaining it. Basically, it's a diagnosis of exclusion. Once you exclude that there's no other cause of these symptoms, then we can assume that it's overactive bladder. And we usually don't have to do more invasive testing like a cystoscopy or urodynamics or other testing. We can usually make the diagnosis based on history exam and a urinalysis. So once you make the diagnosis, what's the first step? Well, the first step is to understand that a lot of this is related to dietary and lifestyle factors. So we do a thorough assessment of all the lifestyle factors that could be contributing. So first one is tobacco or any sort of nicotine products. These can cause overactive bladder symptoms because all of those chemicals end up getting filtered out of the blood and put into the urine and then can irritate the bladder. And basically, that's what you have to understand about this condition, is that the kidneys work as filters. They do a great job of taking any abnormal substances that aren't supposed to be in the blood and filtering them out and then putting them in the urine. So the urine is exposed to all sorts of byproducts of anything that you eat, drink, or smoke. So nicotine, tobacco is one of them. The other one is alcohol. Alcohol itself can be a bladder irritant, but it's also a diuretic, meaning it works like a water pill. It causes the kidneys to produce more urine than they normally would, so it's filtering more fluid out of the blood and putting it into the urine, and that's going to make you have to pee more frequently. And then the irritative properties of the alcohol and a lot of the drinks that we drink with alcohol can cause that increased frequency to be associated with urgency and sometimes even urge incontinence. Now, the biggest one is caffeine, most commonly coffee. And caffeine is similar to alcohol in that effect. It's a diuretic, makes your kidneys produce more urine, but it's also a bladder irritant. It makes the bladder feel the need to urinate, to squeeze down before it's time. So it has a lot of urgency associated with it. And caffeine has a half-life of about 5 hours, meaning that if you drink 2 cups of coffee at 10 a.m., that's the same thing as drinking 1 cup at 3 p.m. or half a cup at 8 p.m. So it takes a while for it to really get out of your system for you to get back to normal. The same thing is true with tea, has a lot of caffeine. A lot of sodas have caffeine, energy drinks. Sometimes these workout supplements that people take have caffeine. So that's a big one. Sometimes even decaffeinated products like decaf coffee, decaf tea have very little caffeine, but they have a lot of other chemicals in them that can irritate the bladder. Same thing with the sodas. Even if you're drinking a Sprite or something that doesn't have caffeine, it has sugar or artificial sweetener that can also cause you to need to urinate more frequently and urgently. The other ones that are less common are a lot of juice, like specifically orange juice. One, it has sugar, but two, it's a citrus. It can be acidic, and that acidity makes its way into the urine, so you have an acidic urine that can cause some of these overactive symptoms. Same thing with a lot of spicy foods. That tends to be acidic, and that can cause a lot of these symptoms too. Then the last factor is constipation. Obviously, it seems like it would be unrelated, but it's really not. If the rectum gets distended, that can just physically push on the bladder because there's limited space, but it's probably more complicated than just that. A lot of it has to do with the nerves. The sacral nerves from the bottom of the spinal cord that go to the bladder have the same nerve roots as those that go to the rectum. And we don't understand this fully, but there's definitely some crosstalk there that when the rectum gets to be distended, it can affect the signaling to and from the bladder and cause these overactive bladder symptoms. So The backbone and the first line treatment of overactive bladder has to be identification and modification of any of these lifestyle factors.